recap from last week. So we talked about what a concussion was. We'll recap that really quick, but what we should know is that a ton of people sustain concussion. It's estimated that almost half of the world's population will sustain a concussion at some point in their life. That's every other person you see on Instagram, every other person you see on Twitter, every other person you can't really see. Well, I mean, I guess you can see people in coffee shops a little bit now, but with COVID cases, I don't know. So a ton of people sustain concussion. It's not an uncommon issue. And there are three things that happen in the brain. So you don't have to take a hit to the head. It can be to the body. The force just has to be transmitted to the head. And when that occurs, you get a stretching and a shearing of your nerve cells. And that causes electrolytes and things to go everywhere, glutamate and calcium in particular. And those are excitatory. It causes this excitotoxicity. And that's this inflammatory event where neurons are discharging everywhere. And that's why you kind of feel out of it. You're like, whoa, because your brain is just having this electrical party. And after that electrical party, your brain has to clean it up. And you've got to move all those electrolytes, that calcium, that glutamate, you got to do something with it. And that causes this massive energy deficit because at the same time all that's happening, there's this autonomic dysregulation. So this fight or flight, rest and digest, sympathetic, parasympathetic dysregulation that causes a decrease in blood flow to the brain. So you've got this stretching, shearing, electrolytes going everywhere, calcium, glutamate firing, and all this stuff happening. And you got to clean that up, but there's less blood getting to the brain. So there's less nutrition, less oxygen, less good stuff getting to the brain to take out the trash and to kind of help clean all that up. When that occurs, you may experience cognitive, so brain fog, difficulty concentrating, difficulty remembering, confusion, emotional, so cognitive, emotional, irritability, anxiety, sadness, depression symptoms. And then you also might experience physical symptoms, so headaches, neck pain, blurred vision, different things like that. So concussion we monitor with the post-concussion symptom scale, we monitor 22 different cognitive, emotional, and physical symptoms to track progress and recovery. And so what we're going to talk about today, what I wanted to talk about, is really acutely. So you were in the car accident, you were in the car accident, you were in the sporting event, you fell over, you tripped over your cat, whatever, and you've hit your head, you've sustained a concussion. What should you do? First, athletes, whoever, really, when in doubt, sit out. So if you hit your head and you felt a little wonky, when in doubt, sit out. We would much rather sit out for not a concussion than keep playing with a concussion, right? So what we know is that, especially in sports, when in doubt, sit out, because your core temperature is elevated, right? You're running around on the football field, you're skating around on the hockey rink, you're on the basketball court, soccer, or whatever. You're running, you're sweating, you're active, temperature is up. We know that when temperature is up, glutamate release also goes up in concussion. So I don't believe there's any studies on this, but the hypothesis is if we can keep core temperature down quick after a concussion, if we can get that down quick, theoretically like an ice bath, but for sure getting off the field, decreasing that core temperature sooner, decreases that glutamate, decreases the excitotoxicity and inflammation, theoretically decreasing the concussion symptoms, improving recovery. So when in doubt, sit out. If you weren't sure, sit out. That leads me to the next thing of seeing a doctor early. So seeing a concussion specialist early. So you were in the car accident, you were on the field, you tripped over your cat, you hit your head, you hit your body, you felt wonky, weren't sure if it was a concussion or you're pretty sure it was a concussion. Either way, see a doctor to get it evaluated. Why that is important, getting a call. Why that is important, seeing a doctor early is important is because we've done studies on timeline to seeing a doctor and timeline to. So I've got my little notes here. We've got a study, I got a nice little like horizontal bar graph somewhere in my Instagram feed where we looked at people that, I believe it was a pediatric study, but we looked at people who saw a doctor within basically their timeline to seeing a doctor and timeline to recovery. People that saw a doctor within 4 days recovered in about 20 days. So they saw a doctor, they got hit, and within that first 4 days, they saw a doctor. They recovered in 20 days. People who saw a doctor within 8 days, so not much different, 4 days, 8 days. People who saw a doctor within 8 days recovered in 77 days, right? 20 versus 77, that's a 57-day difference. That's almost 2 months that these people who came into a doctor later suffered with concussion, almost 2 months longer. So getting into a doctor early, when in doubt, sit out, see a doctor. And then do not hibernate. Do not throw on the sunglasses, avoid the screens, and sit in a dark room until your symptoms go away. Because statistically, the sooner you do that, the longer you hibernate, the longer you do complete rest, the longer you're going to expect to recover, the longer you can expect to have concussion symptoms. More rest, longer recovery. What we know is that after a concussion, we recommend symptom-limited light activity. Symptom-limited means if I'm looking at a screen, say I'm watching TV, I had a concussion, I'm like, oh God, I feel like crap, I just want to watch some TV. I'm watching TV and my symptoms start to flare. That's an activity we gotta cut the screen, right? I'm walking outside with my dog, I'm not running, I'm walking outside with my dog, my symptoms start to flare, I should go sit down, right? We're kind of giving our body these little doses of activity. And what we recommend is, I don't know if I've got the picture here. Again, I posted it somewhere, one of my reels. I talk about symptom limited activity, and there's phases, right? It's called the Likert scale, and you got like flat, happy, or like, I believe it's like happy, flat, and then it goes like cranky. And as you work your way across, it's 0 to 10, and 10 is like the worst symptoms possible. 0 is like, I'm easy breezy, beautiful. If you jump more than 2 points, so you jump 3 points or more, that's an activity that you stop, right? So recap that. Do not hibernate. Do not wall off in a dark room with sunglasses. You want to do light cognitive, physical, screen time activities. So you're allowed to think. You're allowed to use your phone. You're allowed to text. You're allowed to be on the computer. You're allowed to read books. You're allowed to walk around the yard. You're allowed to do these things. Don't drive. But you're allowed to do these things so long as your symptoms don't flare more than 2 or 3 points. If your symptoms flare 2 or 3 points, back off, go chill down. One technique that folks use in the post-concussion world is to find a quiet room and to actually cup and cover your eyes. So just quiet, there's no sound, you're taking away the sensory stimulus, wait till your symptoms subside, and then you can go back out and tackle the world. Hey, what's up? So with that, don't hibernate. And one thing to know is that if you flare 4 points, 5 points, 6 points, you're not damaging your brain. It's uncomfortable. It's not a therapeutic benefit to go that high. So we keep it 2 to 3 points, but know that symptom flares are normal. Recovery is not, I had a concussion and now the symptoms went away. It's often, it's a little roller coaster on the way down. So symptom flares are normal. With that relative rest, of I'm going to walk the dog, I'm going to look at the screen, but I'm going to back off. 2 to 3 days max before you really start to push it. And I will either release it today or tomorrow, but I got a little handout with the first few stages of concussion recovery before you should get a Buffalo concussion treadmill test with a doctor. So look forward to that. So with that, that's what you should do early, right? Early after a concussion, when in doubt, sit out. See a doctor early, don't hibernate, and then on the flip side, do not crush it. I forgot to mention that. Do not crush it. So I say don't hibernate, but don't take that as like a ticket to go do whatever the hell you want. Do not crush it. So high intensity interval training, just going back into your sport, things where you risk a second head impact, not a good idea. Just not a good idea. But high intensity intervals, high intensity aerobic exercise, high intensity just fitness, resistance training. One thing people want to do is they want to lift weights. But say I go to a deadlift, right? And I contract, all my posterior chains contracted, and I come up and I'm bracing. That changes blood pressure. And then that changes heart rate reflexively. And so when you're deadlifting, you might notice your heart is pounding. Kettlebell swings, your heart is pounding. It's not because you're doing true cardio. it's because you're shunting and squeezing blood flow, and your heart doesn't know how to react to that change in afterload and that change in all this fancy jargon. But so your heart rate goes up, and then it goes down, and it goes up, and then it goes down, and your blood pressure goes up, and then it goes down. We've seen that in deadlifts, systolic pressure can go well above 300. Normal systolic blood pressure is around 120, 110 over 70 to 80. And we'll see that systolic number, that 120, go up to like 350 in a deadlift. And your brain, which is already dealing with blood flow deficits, is like, I don't know what the hell to do with that. And its symptoms will flare, and it's not beneficial for your recovery. So don't hibernate, don't crush it. Find that sweet spot, that symptom-limited sweet spot. Again, look for the post with stages, but once you hit stage 4, teaser, once you hit stage 4, after that stage is when you're going to do a Buffalo concussion treadmill test. For most people, that takes 5 to 10 days, right around 7 days by the time you hit stage 5. And if you haven't hit stage 5 in that 5 to 7 days, you should be doing a Buffalo concussion treadmill test anyway, so that we can get you recovering and get you rolling. So, one thing to know that I don't believe I talked about last time, I believe I touched on it, but symptom recovery does not equal metabolic recovery. So what I mean by that is we took the hit, we did those 4 things, we saw a doctor early, we didn't hibernate, we didn't crush it, we sat out from the field, and I felt kind of crappy for a few days, but then a week later, I was feeling good. I was ready, like my symptoms were gone, I was ready. Hold it there, my friend. What we know is that symptoms will typically peak. So let's look at brain energy levels. So brain energy levels are 100%. I had the concussion. 3 to 5 days later, they dip. And 3 to 5 days after the impact is when most people feel their worst. Then they start to rise. And right around here is 7 to 10 days, right? So we're not back up to here. Right around here is 7 to 10 days, and that's when people's symptoms go away. It takes about 21 to 30 days before metabolic recovery has actually happened, right? So we dip and then we come back up. If we take a hit on this slope, we risk a further dip and a longer recovery, and that further dip could actually be a much more serious injury. So symptom recovery does not equal metabolic recovery. Symptom will usually go away 7 to 10 days. Metabolic recovery usually happens in 21 to 30 days, and that's when we're usually clearing people. Again, the people who see a doctor within 4 days are cleared within about 20 days because they're metabolically recovered, and we can track that. So who's at risk of delayed recovery? That's the last thing I wanted to talk about because this has been jam-packed. I didn't realize I would get through so much information. So who's at risk of post-concussion syndrome? We're trying to call it persistent post-concussion symptoms now in the research world. But who's at risk of PPCS, persistent post-concussion symptoms? We know that females tend to go towards post-concussion syndrome. It could be that females are just honest and males are not. There's some other physiological reasons there. Dr. Paul Herkel did a good video on this recently. Dr. Cameron Marshall of CCMI has done a few videos on this if you scroll through his feed. But for some reason, women tend to sustain post-concussion syndrome, persistent post-concussion symptoms a little bit more often than men. And I would argue that a factor in there is the lack of honesty from men. We also know that mental health before the concussion can delay recovery after the concussion. So pre-existing anxiety, depression symptoms can worsen the anxiety, depression symptoms after concussion. And if there's a traumatic component to the concussion, there can also be PTSD. And those symptoms can overlap with post-concussion a lot. One thing to know about post-concussion syndrome is if we survey, this popped into my head, if we survey the population, so we just sweep the quote-unquote healthy population of the world, around 30% of them are going to meet the criteria for post-concussion syndrome. And so what that means is it's kind of sticky. That's post-concussion syndrome has been sort of a debated diagnosis, but what it means is that following a concussion, it can get messy. Overlapping conditions can kind of come in. So what we know is that if there's pre-existing anxiety, depression, PTSD, or there's post-concussion PTSD, post-concussion anxiety, depression, those kind of overlap, right? Hello. So women, Anxiety, depression. We also know that learning disabilities, particularly in young kiddos, so ADHD, learning disabilities, pre-concussion can delay recovery after concussion because there's some things that go on with your default mode and executive function networks after concussion. The wires kind of cross for everyone, but if the wires were already kind of crossing, it gets a little bit harder to rehab. And there's things we can do for that. Also, what we know is that folks who have, this is noted in the Berlin concussion consensus, which is kind of the big consensus statement on concussions. The more severe the symptoms are early, the more likely you are to have a longer recovery than folks who had a little bit fewer symptoms early. So folks who had more and more severe symptoms versus folks who had just a few symptoms, early experience can kind of dictate what we can expect for recovery. And then also resting too much. So hibernating in the dark room, closing the blinds, not looking at screens, just kind of hermiting. Not great for the brain. So let's recap. We covered a lot. So recap, go listen to Almost Sweet Music by Hoser. Lots of people sustain concussion. If you want to learn more about that, go back to last week's Instagram TV. It's in my Instagram TV tab, but we talked about it last week. So what should you do? You've been in a car accident, you tripped over your cat. I keep saying that because I've had a patient that got a very severe, moderate TBI. I shouldn't say severe, but moderate TBI from tripping over their cat. So what should you do? When in doubt, sit out. We don't want you sustaining another hit. We don't want you keeping that body temperature up, getting more excitotoxicity, more inflammation. See a doctor early. Seeing a doctor in 4 days versus seeing a doctor in 8 days is a difference of 57 days of recovery. See a doctor within 4 days, those folks recovered in 20. If you see a doctor within around 8 days, you're going to recover in around 77 days. That's 2 months extra recovery because you didn't see a doctor early. Don't hibernate, don't crush it. Symptom recovery does not equal metabolic recovery, so your symptoms are going to go away in about a week in most people, but your metabolism isn't going to recover for around 3 to 4 weeks. If your symptoms do not recover in that week, it's persistent post-concussion symptoms, post-concussion syndrome. Who's at risk for that? Mental health, so anxiety, depression, PTSD, females, ADHD, learning disabilities, folks who have a lot of symptoms early, and folks who rest way too long. So what we'll talk about next week is, say you did some of the right things, say you did some of the wrong things, say you did some of the right things, say you did all the right things, and you're still experiencing symptoms, and it's been 2 weeks, 2 months, 2 years, post-concussion syndrome, persistent post-concussion symptoms. What's going on there? And what I won't talk about what we can do about it. We'll talk about what's going on there, and we'll tease at what we can do about it because that would be a very long discussion. Thank you guys for joining me. If you have any questions, feel free to leave them in the comments. We will be back